Welcome, Dr. David Agus, to our latest How conversation. Personally, it's just special and a pleasure to be in conversation with you. I want to start by saying that we are close and dear friends, and I cherish our friendship. I've learned a lot from you, and professionally, I respect you. Your bio is well known, but I will recite some of it. Dr. Agus is currently the professor of medicine and engineering at the University of Southern California. You've authored not one, not two, but 3 New York Times bestsellers. You're also the founder and CEO of the Lawrence J. Ellison Institute for Transformative Medicine at USC.
Thank you, David. I mean, it's truly a pleasure to be here. And I mean, and the one part of my bio I think you did mention is that you've had a significant influence on me. You know, our conversations, you've helped me dramatically in how to frame issues. I may know the science, but it's not just the science that gets things done, just how you frame it and how you present it. And I keep using that word how, and I'm sorry about that. But our conversations have dramatically influenced, whether it's writing a piece in the New York Times or whether it's giving a talk or trying to enact the behavior change and the normative change that we need in healthcare.
That's kind of you to say, but where did it begin? Your journey of exquisite excellence in science and medicine. But deep down, there's a heart. Deep down, you've been on a journey of moral leadership. What is that rooted in? Where did it start? Share some of your family history. I know it, but I think our listeners would love to understand it as well as I do.
You know, I came from 2 parts, right? I mean, there's the old expression that in order to understand peace, you have to go to war. And on a daily basis, I sit face to face with patients with advanced cancer. And I see the desperation in their eye. And so there's really a striving on my part and a realization of my weakness. And the weakness of our system is we can't cure advanced cancer. We could potentially lessen some of the symptoms, make you live a little bit longer, but that's about it. Whereas we're pretty good on the prevention side. Right. And so it really was a passion is I don't want to experience failure more. I want to prevent, and it's pushing that direction. And then, you know, listen, I grew up in a household where I was taken under the wing of my grandfather, who was a well-known rabbi and philosopher. And he had wrote books about religion changing with the times that were considered heretical at the time. And he was actually, you know, pushed out of many communities and pushed almost excommunication because of what he wrote. But he had a firm belief in moving forward and using the change in our times to change some of the normative behaviors within religion. And I respected him.
So David, in terms of where we find you today, you've been in the thicket, at the front lines of fighting the pandemic, of just trying to help us not have as much harm as we were having, but also find, you know, pathways to emerge. So where are you today when we are starting to emerge from a pandemic to a post-pandemic world? What have you figured out? What do you want to leave behind? What do you want to take with us? What are you in the midst of redesigning?
You know, it's interesting. I mean, you know, in my field, we have exactly that. We have the reflex and we have the pause, right? Much of the actions in the healthcare space is reflex. This happens, do this. And we don't pause enough. You know, in one of my exam rooms, and you've yet to be to our new building, and it really is special, but I have a photo of a sculpture from Italy. And this is a sculpture of a man named Edward Jenner who is vaccinating his son. And where it came from is that Jenner saw women milk the cows in England in the early 1800s. And back then, smallpox was killing off 11% of the world population. And he would notice pox on their arms and they wouldn't die. And they're the only ones who took care of people with smallpox without dying. So he goes to the King of England. I want to stick a needle in, draw pus out of their arm, and I want to inject other people. And the king says, get the hell out of here. And he goes, I'll inject myself. And he says, every scientist says that, and he kicked him out. That night, the king had a dream, he says, of the King Solomon experiment where 2 women went to the king and said, hey, this is my baby. And King Solomon said, I'm going to rip the baby in half. And the real mother said, you take the baby. And he thought, listen, I have to think of something to do that with this vaccine. He calls Jenner back and says, you have one child who's 5 years old. And I know how difficult it was for you to have children, especially in the smallpox era. If you inject your child, I know you believe. And this is a sculpture of Jenner injecting his child. And this was the first vaccine. And I had actually written the Italian government several years ago saying, I want to make a copy of it because it's so meaningful to me. It's meaningful to me, not that it's the first vaccine. historic milestone, but science can be done and is done by great scientists around the world. And most of the time, nobody hears it or listens to it. But in this case, the King of England was the second to receive the vaccine. The royal family were numbers 2 through 11. So that leadership is what enabled vaccines to be normalized across the globe. For the first time in the world saw the sausage being made in our field. And we saw people just talking and not thinking of the ramifications of their words and of their actions. And there weren't people stepping up to really normalize the right ideas, the right behavior. And it became more about a belief system than data. And we have to go back.
So the world needs to turn to people like you who are schooled in science and the scientific method and have an approach to figuring out efficacy. So at the same time where the world needs to turn to experts and those with scientific backgrounds, it's at the same time that they've been attacked and discredited, at least by one side or the other. How do you lead as a scientist and as a medical professional when your profession in many ways is fighting misinformation about it at the same time?
It was interesting. I learned a lot of that from you in many respects, and I hate to keep being deferential to you. It's better for the audience if we argue and beat up each other. But I was in my backyard talking on the cell phone to you, and you told me about, the way in America we really stopped smoking is the secondhand smoke argument. And it really was a powerful argument to me, is that, I could argue all we want about the data and efficacy of vaccines. But if I say, hey, listen, by choosing not to get a vaccine, you can harm your neighbor, your grandmother, and others. That secondhand smoke argument, it's not what it does to you. You have every right in the world to smoke in your bedroom, but you don't have a right to smoke in front of a child, at a restaurant, on a plane, because you can harm others. That argument, started to make sense to me. And really, it helped many people.
If you want to kill yourself, it's fine. But when smoking became socially stigmatized, when we started to learn how secondhand smoke kills the other. And I see that you've been making an analogy to that. So I want to
it's deeper, right? It's that I need to learn from history. I need to look at the King of England and what he did, what you talked about in the secondhand smoke. I need to talk to philosopher. I can't stay in my lane in order to influence people. I have to learn from others and use that collective learning to influence people, because every day sooner I can do it, we can save a lot of lives.
And now when the pandemic just started to engulf the world, we didn't have all the data. We didn't really know about the efficacy of masks. So how do you lead in a crisis when the data is not in? And people still are feeling vulnerable. They're turning for guidance. You have to give guidance. You're a scientist. You know that you could be more reliable and confident when you have data. And I know that you're obsessed with data, but when the pandemic happened, we didn't have all the data that we needed around masks and around ventilators and et cetera. So how do you lead when the data is not in?
It's very interesting. To me, it's about two things. One is networking, right? Is that I need to run my ideas by equivalent medical leaders and healthcare leaders in different countries and around the globe. We have to make each other better, and we have to learn from each other. Hey, I just went on air and I said this, and people just reacted negatively. And so we helped each other. It's the first time in my life, through the power of Zoom, where we're talking on right now, through the power of Zoom, I would have calls with researchers in Oxford, in France, in China, in India, literally on a daily basis. And we would learn from each other and help each other, run ideas by each other, run observations by each other. That power of collaboration is what got all of us through it and enabled us to make some declaratory changes. And then it really was just keeping our blinders on and, explaining. When you tell someone what to do, their shoulders go up. When you explain to them the data, they almost always do the right thing. And when you explain to someone, listen, I don't have data on the role of masks yet, but my gut is XYZ, and here's why, people actually change and do things.
It seems that the data is in. Vaccines work. And yet we're not exactly where we want to be in terms of vaccination rates. And here's the conundrum. I think you and I both know that to truly scale and to enter the hearts of others, we should inspire them to change behavior or to be normative in the ways you talk about. How do you choose between or assimilate or harmonize the attraction of mandates when the data is in? Because you believe you've got the science now, say, on vaccines, so why not mandate? You're right. And knowing deep down that inspiration is preferable.
It's very interesting. I get to cheat, right? I shouldn't say this publicly, but I know data many times months to longer before it's public. And it's very frustrating when you know the answer, yet you can't publicly state it. So I spent a good fraction of my time pushing academics, pushing governments to release data so we can get it out there, right? Careerism stands in the way. I
Right.
spent my career building this data set. I need to publish it in the New England Journal of Medicine so I could be promoted. How dare you take away my promotion for the public benefit? And this is the arguments that I face daily, because I know, right, if I could start to tell a story and have data behind it, I know I can influence a lot of lives. If I get up there and just say, hey, I really think vaccines are going to work, trust me, nobody's going to respond in the way I want them to respond. And so part of my job behind the scenes is really ugly and dirty. It's really pushing people to get that data out there. That leadership position, and to normalize things like releasing data, not by the old means of publication and peer review, which made all the sense in the world in peacetime, but in wartime, we have to think differently. Whose job is it to do that? And that's what we came in right into face with. There wasn't someone in the government's job to say, hey, release that data. No matter what country you're talking about, those kind of institutions didn't exist. And so we had to do it ourselves and really provide that backdoor, the back of the room leadership to do that. And that's what got scary and frustrating.
And when trust is low in society, as it has been, even when the data is accurate, it's not trusted by enough. How do you break that vicious cycle of even not only releasing data, even when it's accurate, it's not trusted by a sufficient amount?
It's tough, right? I mean, you get a lot. I had death threats. I mean, to a small cancer doctor at a university getting death threats and getting, thousands of inbounds of people pissed off at you. It is scary. I mean,
Right.
You feel alone. You feel vulnerable. But at
Right.
the same time, you have to be steadfast in your belief and in your communicating with others and in drawing the data and in iterating. And then if you say something that changed, you have to explain why. Yesterday, I said this, but there's now new data that's changing my opinion. And here's why it changed. And I apologize for yesterday's conclusion, but it was wrong. You have to be vulnerable. You have to be transparent. We're not built like that, right?
Is there an
We were built
example
to be
you
in an
can
ivory
give?
tower.
Is there an example you can give? I've seen you do this where you led with data, got new data that changed, and you did pause and apologize and say, got this wrong, and where you created new connections through that humility and vulnerability of apologizing and owning the mistake.
Early on, I think we all thought that this was going to be like other viruses, in that when you're symptomatic, you spread. With the flu, with the common cold, when you're symptomatic, you spread. So getting asymptomatic people to wear masks was just taking away PPE from healthcare providers and was causing a panic because people were hoarding masks. People were trying to get it so they could resell them. And it really was causing an issue in the country. So I and others got out there and said, hey, listen, an average person asymptomatic wearing a mask or hoarding masks doesn't make sense. Let's save them all for the healthcare providers, because they're the ones who need them. Because if you're asymptomatic, you can't spread the virus. And then all of a sudden, we started to hear anecdotes of asymptomatic spread. And then we got the data. This is the first virus that I've been privy to where when you're asymptomatic or pre-symptomatic, you could spread that virus. And it all changed. And we had to explain that and explain why we were wrong and why the data made us change.
So given the state of the data today, if a CEO of a large publicly traded company comes to you and says, David, where should I come out on mandating versus incentivizing and motivating versus coercing vaccines?
It's a really difficult question. 7% of the US population will not respond to a vaccine. They have leukemia, they have an autoimmune disease, they're an immune suppressive drug, they're too young to get vaccines, or they have an infant at home, all of the above. And so you as a CEO have to make a decision. Do I want to tell anybody who can't respond to the vaccine, you can't come to work because you could be harmed because there are people who may not be vaccinated? Or do I want to take people who are in their control to be vaccinated and say, listen, I don't want you at the office because you can potentially spread to others, because you could potentially harm others, because we're a publicly facing company and there may be a customer who comes in who has a lupus that you may harm them by spreading the virus. And it's going to take guts to stand up. I think throughout this pandemic, many CEOs I've had conversations with on a daily basis, and some of them have a remarkable way of leadership of explaining to their employees and saying, listen, you have a right not to be vaccinated, but you can't come into the office. You have to work at home and we can't have that. And here's why. And let's explain the data, because we want to protect all of our employees, not just some of them. And yes, I think it is a gutsy move. If Bruce Springsteen can say, you can only come to my Broadway show if you've been vaccinated, hell, CEO of a public company should stand up like Bruce Springsteen did.
Thank you, David. Thank you, Dr. Agus.
And thank you for being a friend that, course corrects me on a regular basis in a good way, a positive way, and enables me to achieve what I hope to achieve. So thank you.